Hey listeners, this is Kelsey and Nate here from the Emergency Medical Minute, and we are excited to tell you about our next big event, Untamed, an event about medicine and wilderness as medicine.
Picture this. You are canyoneering in the San Rafael Desert, the most remote desert in the United States, and suffer an unfortunate fall that leaves your right hand pinned by a boulder. Posed by the threat of death by dehydration, you have to choose between your life or your limb. Our keynote speaker, Aaron Ralston, portrayed by the film 127 Hours, was in this exact position. Guests will hear Aaron's story, along with other inspiring tales of survival.
Guests will also hear from a panel of medical experts on how to survive the wilderness and embrace it as a form of medicine. Tickets and event information are available on our Facebook page and website, emergencymedicalminute.com.
Good morning, everybody. So I was going to do a little medical minute from a case I had recently. So the case was a almost 11-month-old toddler, so a little boy, who was kind of getting ready for bed and brushing his teeth, getting on it early, which is nice. Unfortunately, his 3-year-old sister came up behind him and accidentally knocked him over while his toothbrush was in his mouth, and he jabbed himself in the back of the throat with his toothbrush. It's a kind of recurrent thing that we see, and it's kind of an interesting injury because it has some serious potential consequences, but usually doesn't look like much. So a lot of times they come in, there might be a little scratch in the back of the throat, or sometimes hardly anything. But the couple of problems are that you can have a pretty bad penetration into your kind of soft palate and the pharynx, and then not see much. And the couple structures that we worry about being injured are the carotids. When we do peritonsillar abscess aspirations, we worry about hitting the carotid artery, and same thing with a little injury like this, you can hit your carotids. And those are usually kind of more lateral injuries, so if somebody has an injury kind of more in the midline, it's less likely to affect the carotids. And then the other general kind of space is the whole kind of retropharynx, and it's a space that usually doesn't have any injuries to it, doesn't get your mouth bacteria back there. So if you have, you get some bacteria into your retropharynx, it can lead to potentially really bad infections like a retropharyngeal abscess. It can spread down into your chest and get mediastinitis. So potentially serious. So what we do is, initially we see the kids, make sure they're stable. Rarely you could have, a big hematoma that can cause an airway problem. Most times that's not the case. And then we have to decide, was this potentially a serious issue? So the imaging would be usually a CTA that would look at the carotid arteries and look to see if there was a bad injury. And most of the times these kids can go home. We tend to put them on antibiotics to prevent an infection, but sometimes they can have vascular injuries, and sometimes they need to stay in the hospital to kind of be observed. So this kid actually did have a lot of air in his retropharynx, didn't have any vascular injuries, got admitted and got antibiotics, and did fine, went home after a couple days. Any questions? Thanks, guys.